Hi, this is Dr. Barto with Barto Family Chiropractic. I wanted to share with you some of the ins and outs of prenatal chiropractic. I see a lot of misconceptions out there, even in the birth world. I see doulas looking for chiropractors that can turn a baby and that sort of thing. So I thought maybe it would be a good idea to share a video kind of about the whys and the hows of prenatal chiropractic. So to begin with, you might wonder, why would you need a chiropractor during pregnancy? Well, the most obvious answer is pain. People think about chiropractic and pain, and I've been through pregnancies myself, and there's back pain during pregnancy. It's a given. It's going to happen, but it doesn't have to be so intense. So a lot of women will, when their back starts to hurt, they will give us a call. And other women are much more proactive, and these ones I really love, that they won't wait until they have back pain or really any specific concern whatsoever. They'll just start chiropractic care or continue with their wellness chiropractic care throughout their entire pregnancy, because they understand that while chiropractors are absolutely amazing at helping people with back pain and neck pain and headaches, these people have realized that where chiropractic really shines is helping your body function the way that it's supposed to. And during a woman's life, I can't imagine any time more important than pregnancy that is necessary to have optimal functioning. It's going so much beyond just you and how you feel, but making sure that the way that your body functions supports a healthy, growing baby. So you want to make sure that everything is aligned, that your body is as stress-free as possible so that you can have an awesome, comfortable, healthy pregnancy. And at the end of that, your body has to do this amazing physiological process. It's a very normal process called birth. And even though it's a normal, natural process, there are things that can happen with your body that can kind of slow it down. So what we want to do is make sure that the pelvis is aligned the way that it's supposed to, so that it can open up and that the baby can get through the passage as easily as possible. We also want to make sure that the neurology is as clear as possible. This thing called birth is this amazing orchestra of events, and it all has to be coordinated appropriately. So the reality is that the better your nervous system functions, the better the birth process can be orchestrated. And for that reason, we have studies that show us that women who are under chiropractic care their entire pregnancy have faster, safer, easier deliveries. Why wouldn't you want that? So why start chiropractic care? Why get prenatal chiropractic care? We would do this just because we want to have the best birth possible that we absolutely can. The next question then is, when should we start? There's a lot of misconceptions around this as well. So a lot of people are real nervous about that first trimester, and that it can be a kind of a delicate time where you're not really sure if the pregnancy is secure. So for that reason, you might want to avoid some things. It gets hard to find a massage therapist that'll see you during the first trimester. But with chiropractic care, if you're seeing a qualified practitioner, the way that we do adjustments are so light and so non-invasive that it's like we're not going to cause any problem. So you can start chiropractic care as soon as possible. You don't have to wait until any specific time. You just want to get going. The earlier you start, the better and stronger your body will become. So you want to start as early as you possibly can. Ideally, you want to start before you even conceived. So that's when to start. The next question then is how does it look like? So I said a little bit earlier, I said a little bit before that there's no contraindications to starting early. And the reason that is because a chiropractic adjustment can be very, very gentle. In our office, whenever women are pregnant, we use these pillows. So they don't have a center in them. They're a real high density foam, but no center. And so the mommies can lay on the pillow and their bellies can get nestled in here. So you're not laying with any pressure on the belly. And then we use different techniques. We use what's called an activator. I don't have it actually here, but it clicks. So we're not pushing into the belly. We're not pushing down on top of the belly. I don't push anywhere between the bra line and down. So because there's a baby in there. So we use an activator, which doesn't have any like strong force with it. It's very gentle. Or we use some other techniques to just look like gentle touches, and we work with how your body moves. So it's really gentle, it's really comfortable, and it's safe. So the last question is, well, how do I know how to find a practitioner? What you want to look for is a Webster certified chiropractor. The Webster technique is a specific technique that addresses all of the bony tissues as well as the soft tissues of a woman's pelvis. And making sure that we address it, that we analyze it, and we can adjust and address any imbalances as gently as possible is really what the Webster technique is all about. Some chiropractors know that there are certain things that you should not do with a pregnant woman, and if they know that they shouldn't do it, sometimes they just won't do things. But that doesn't mean that they know what to do. And so throughout taking a Webster certification teaches chiropractors what to do. And that technique, what we have to do to keep our Webster certification is keep continuing education. So finding somebody, you can go to the ICPA4kids.com, and they have all of their members listed throughout their directory, which you can look by your zip code. But next to the practitioner's name is they have their credentialing. So if you look up me, you'll see that I have the Webster certification, and I also have a CACCP, so I have a pediatric certification as well. So that's what you want to look for in a pregnancy chiropractor. From my own personal experience, why it became so important to me to become Webster certified. Well, when I graduated, I was my care was overseen by one of the instructors at my college, and he was like the best pediatric chiropractor in the U.S. I swear. And so I saw him, or I had somebody that oversaw my care with him. And when I came back to Pennsylvania at the very end of my first pregnancy, I looked for Webster certified chiropractors, and that's just what I did. 4 years later, I worked for another chiropractor who wasn't Webster certified. And I got good care. I felt pretty good there. However, he went away late in the pregnancy, and I needed adjusted. So I went back to my who took care of me during my first pregnancy, and there was this night and day difference between what I was having done all the time and what the Webster chiropractor did. And I had forgotten about that in that 4-year span. So once I had another Webster adjustment, I was like, oh my gosh. I can't see another pregnant woman unless I know how to give them a Webster adjustment. And so that was my inspiration. Right then and there, I went and I took the Webster class and proceeded on to get the entire certification, because I wanted to make sure that I didn't provide just good enough care for women. I wanted pregnant women to have the best care. So that's why I did that. Fast forward to my third pregnancy, and there was a time where I was like desperate for an adjustment, and so I let somebody adjust me in a way that I wouldn't normally recommend anybody to get adjusted, but I figured like, oh, it'll be fine. I'm really early in the pregnancy. They can twist me. It'll be okay. And I couldn't walk after I got adjusted. So that renewed that fire and that passion in me as to why it is so critically important that women see a Webster certified chiropractor so that they get care that is appropriate for them, that is safe for them, and that they actually understand and get to recognize the full benefits of a thorough adjustment during pregnancy. So I hope you guys had, I hope that was informative for you. Somebody had messaged in, where are you from? I'll message that after here. But if you have any questions, feel free to send me a message. You can call the office. Taking care of pregnant women and helping them have a comfortable and then joyful pregnancy is what I really love to see happen. I love to see mamas have amazing birth outcomes. So it's really like a real joy of mine to take care of pregnant moms. But if you have any questions, feel free to reach out to us here, and we will help you find a qualified Webster certified chiropractor for your care during pregnancy.